A high fasting sugar can feel like proof that yesterday failed, but that is often the wrong conclusion. The morning number is not just a food score, it can reflect sleep, liver sugar release, stress hormones, medicine timing, or an overnight low. The first step is not eating less, it is finding which pattern created it, so the wrong fix does not become tomorrow's problem. Many people respond by eating less at dinner. That may lower the next morning's reading when a large or late meal is part of the problem, but it can miss the real cause. Fasting blood sugar is measured before breakfast, after several hours without food. During that time, the liver can release stored glucose into the bloodstream, so the morning rise may begin even without eating. That pattern matters because it shows whether extra sugar is still left in the blood. Glucose is sugar from food and liver storage. Insulin is the hormone that helps move that sugar into cells. A fasting rise often happens when the liver releases sugar and insulin cannot clear it efficiently. Start with the first split. A high number after a late heavy dinner is different from a high number after a steady dinner. One points toward food timing, the other points toward overnight biology, sleep, stress, medicine timing, or measurement error. This is why one morning reading can mislead you. If you only blame dinner, you may shrink food while the real problem keeps repeating. If you only blame hormones, you may ignore a large starch portion. The fix depends on the pattern, not guilt. Check the simple things first. Wash your hands, use a clean strip, and repeat the test once if the number seems strange. Food residue on a finger can falsely raise the result. A bad reading should not become the basis for a new routine. Then compare 3 points: bedtime, waking, and after breakfast. If bedtime is high and morning is high, the night may be carrying dinner forward. If bedtime looks fine and morning jumps, the liver, sleep, stress, or medicines deserve more attention. That difference matters more than another list of possible causes. Two people can wake up at the same number for opposite reasons. One may need a smaller late starch portion, another may need better sleep, a medication review, or testing for overnight lows. A disciplined evening can still produce a high morning. A light dinner does not cancel poor sleep, untreated snoring, pain, illness, or missed medicine. The meal can look controlled while the night stays uncontrolled. That is the uncomfortable trap. Sleep apnea means breathing repeatedly slows or stops during sleep. Loud snoring, morning headaches, and daytime sleepiness can be clues. When breathing is disrupted, stress signals rise. Those signals can tell the liver to release more sugar before breakfast. Stress can do something similar. A hard day, poor sleep, fever, pain, or anxiety can raise hormones that push stored sugar into the blood. This does not mean stress is imaginary. It means the body is using emergency chemistry while you are trying to rest. Exercise also splits into two patterns. An easy walk after dinner can help muscle use sugar. A hard late workout may raise stress signals in some people. Judge it by the next morning number, not by whether it sounds healthy. Food still matters, but the target is not starvation. Start by shrinking the late starch portion, adding vegetables, and keeping protein steady. That tests whether dinner is carrying over. If the morning number barely changes, stop blaming willpower alone. The strongest clue is not one cause name. It is the gap between bedtime and waking. A high bedtime number points toward the evening meal or missed medicine. A normal bedtime number followed by a high morning points toward overnight production. Do not ask which cause sounds most believable. Ask which pattern the numbers show. Dinner carryover, overnight liver release, and overnight lows require different next steps. A continuous glucose monitor can help some people see that pattern. It tracks sugar through the night instead of showing one morning snapshot. A slow rise before dawn is different from a sharp rise after a late snack. A dip followed by a rise is different again. That pattern can mean sugar went too low first, then the body pushed it back up. Morning sugar then looks high, but the first event was the drop. Alcohol can confuse the picture. It may lower sugar overnight in some people, then create a rebound or poor sleep pattern. A drink with a late snack adds another variable, especially on weekends. Test alcohol-free nights before building a theory around breakfast. Medication timing can also change the pattern. Some medicines work better when taken at a specific time. Others can increase sugar as a side effect. The cause that repeats under the same conditions matters more than the cause that sounds most dramatic. Caffeine is usually not the main cause, but it can raise stress signals in sensitive people. The test is simple. Compare several mornings with the same breakfast, same sleep schedule, and different caffeine timing. One day is not enough evidence. A bedtime snack is not automatically good or bad. It depends on why the morning number is high. If the problem is hunger, skip dinner, or an overnight low, a planned snack may help. If the problem is late starch, it can worsen the pattern. So the snack answer is conditional. A small protein-based snack may be useful for selected overnight low patterns. It is not a universal fix for every morning high. Use the pattern before using the snack. An overnight low is the opposite problem. Sugar drops too low during sleep, and the body may push it back up. Morning sugar then looks high, but the story started with a low. This is especially important for people using insulin or sulfonylureas. Before changing doses, separate ordinary patterns from higher risk situations. Readings far above your usual range, symptoms, pregnancy, insulin use, or kidney disease need medical guidance. Those situations can change risk quickly, so individual instructions matter. Pregnancy, kidney disease, and insulin use matter because the safety margin is smaller. A wrong correction can cause harm faster. This does not mean panic. It means the plan should come from your clinician, not guessing. Symptoms matter because the number is not the whole story. Vomiting, confusion, deep breathing, chest pain, severe weakness, or dehydration changes the plan. Do not try to solve that with a snack, coffee change, or extra exercise. For ordinary patterns, use a 7-day log. Write bedtime sugar, waking sugar, dinner timing, starch size, alcohol, sleep quality, exercise timing, and medicine timing. The point is not perfect tracking. The point is finding the repeating lever. Then change one lever at a time. Move dinner earlier, reduce late starch, walk gently after dinner, protect sleep, or review medicines. Changing 5 things at once may lower the number, but it hides what actually worked. If one lever improves the pattern, keep it steady before adding another. If nothing changes, that is also useful. It tells your clinician the answer may not be dinner alone. A high fasting sugar is a clue, not a verdict. The useful question is whether it came from dinner, the liver, sleep, medicine timing, or an overnight low. Match the fix to the pattern. That is how the morning number becomes useful instead of frightening. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.